All right, everyone, good afternoon. This is Brandon Sturgill with the Ohio Department of Mental Health and Addiction Services, Pre-Admission Screening and Resident Review, PASRR Bureau. This is the presentation on the expedited PASRR process for pre-admission screen applications that originate from psychiatric hospitals or psychiatric units. It looks like we've got about everybody filing in here, some people still slowly appearing for the training. So we'll go ahead and ease on into the information. Just a couple of early points. There are on your screen the ability to do a couple of things. We've got a questions feature through the GoToWebinar, and we've also got a chat feature. So I'll keep an eye on those. If there are issues on your end, if you would let me know, either through that chat feature, you can type a message. If the audio becomes difficult to understand, or if there's anything else that you might be concerned with. There will be perhaps a couple of minutes at the end here. We'll play it by ear and see if there's time for any quick questions. But there will be a formal frequently asked questions document that will be developed for this training. And there will also be a link to a dedicated email address if you do have questions regarding this presentation or this process, so you can ask them there, and the presentation itself in the recorded format should be available too for you to view if you do have any questions after the fact. So let's go ahead and jump into a little bit of the content here. For those of you that might be new to PASRR or who maybe could use a brief overview of what PASRR is, we'll talk about that first, and then we'll get into the specifics of why you're all here for the expedited PASRR process. So a couple of details about the process or the PASRR program. This is a federal program. It must be implemented in order for Ohio to receive federal match for Medicaid reimbursable nursing facility services. The program, in fact, is a condition of the approval for the state plan for Medicaid. It does apply to all individuals that are seeking nursing facility services, and this is regardless of payer source, regardless of known or suspected diagnoses as well. It's very important to consider. The assessments that come out of this program do result in person-centered recommendations that are regarding placement and treatment options. These are things that can be integrated into care planning and some other recommendations for service and supports in the setting that may be recommended through the PASRR outcome. It's implemented through a multiple state agency and a state contracted vendor. So this is a very complicated, very large program, and we'll kind of clarify some of the operations here as we progress through the slides. When we think about reimbursement for nursing facility services, it's important to note that no individual with a serious mental illness, an intellectual disability, or a related condition is eligible to receive Medicaid in a nursing facility unless they have been found appropriate for placement through the PASRR program. So it's paramount that we stay in compliance with PASRR and realize the importance of this program to make sure that people are in the appropriate setting and eligible to receive Medicaid reimbursement once in that setting. If you think about PASRR on two different levels, this is a pretty basic concept. So at level 1, we have a screening tool. At level 2, we have a comprehensive assessment. On the level 1 screening tool, we have at level 1, we have state designated authorities. The two designated authorities are the Department of Developmental Disabilities and Department of Mental Health and Addiction Services. It's important to note that they are not responsible for level 1. In fact, the Department of Aging is responsible for PASRR at level 1. They are the ones that are the entity that's the keeper of the level 1 and that content. Now, when we talk about level 2, I think that's probably where a lot of people are familiar with the PASRR process. This is the outcomes. This is where we get PASRR reviews and PASRR determinations. This is, in fact, that comprehensive assessment that you would be familiar with or that you might see inside of your hospital or the psychiatric unit within your hospital. Now, the County Department of Developmental Disabilities is responsible for level 2 in some capacity, as is Ascend Management. We'll clarify both of these as we move forward. But the state designated authorities do use this level 2 as the foundation to render that final PASRR determination. Now, to expand on the responsibilities for level 1, the Department of Aging does contract with the passport administrative agencies. You've probably heard these referred to as the PAAs. The passport administrative agency assist with completing the screen, so they act as a technical assistant to complete the 3622, which is that screen I'm referring to. They do record and they retain that data from the screen in their systems, and they review the screen for accuracy, and they route to the correct entities. So that's a lot of their responsibility. And at this point, if I'm not mistaken, we've got 13 distinct area agencies on aging. When we talk about level 2 in further detail, and we look at the two state-designated authorities, we've got Department of Developmental Disabilities and Department of Mental Health and Addiction Services. The assessments on the DD side are completed by 88 different county boards. The assessments on the mental health and addiction service side are completed by licensed mental health professionals under a state contract with a firm I'm sure you're all familiar with. If you're not, you will be, by the name of Ascend Management. They're the ones that contract with us at the Department of Mental Health and Addiction Service to complete this task. Ultimately, these assessments are submitted to the state reviewer at the state level to review documentation, make a final determination. So just to dispel any type of a myth or any type of confusion that may be out there, the final determination does rest at the state level. It is not made by the individuals that actually complete the level 2 evaluation for the state designated authorities. When we talk about PASRR reviews, this is similar to the levels, but a little bit differently. We talked earlier about what's level 1, what's level 2. Now, what makes up PASRR are two distinct components. The first component that we talk about is the pre-admission screen. This is for all individuals that seek nursing facility placement from the community, or what you're all probably more familiar with from your perspectives would be from a psychiatric hospital or psychiatric unit within a general hospital, and I'll probably use those terms interchangeably, but they do have the same meaning. If you think about the resident review, this is for all existing nursing facility residents who previously met using, but we'll talk about that and what that actually looks like as we move forward here. But it is the same basic application process for both the pre-admission screen and the resident review. It's the Form 3622 PASRR identification screen. It's referred to as a couple of different things, but it is in fact the same form and the same process to complete that form. Some of the determinations that may be seen by the hospitals are the approval, the emergency approval, the respite approval, a denial, a case closure, and a specified period approval. We'll clarify a couple of the more important ones, but if we could just run through maybe and think about the PASRR outcomes and what the determinations actually are. You may not see each and every one of these types of determinations as staff in a hospital. You may, in fact, only see a couple of these, but it's important to note which ones that you may see and what they actually mean. If we talk about a approval for admission or retention, we're in effect saying that the individual does require nursing facility services. On the emergency approval, this is what's referred to as a categorical determination, and we're saying that due to some imminent risk, the individual does require 7-day emergency placement in a nursing facility to prevent a serious risk. On the respite approval, you may not see quite so many of these. These are, in fact, more geared toward caretakers that do care for the individuals that we serve. They may need a respite, a 14-day break, and this is, in effect, something that's available to them. The denial is probably the most concerning, I think, that everybody is familiar with. And in effect, what the PASRR outcome is saying is that this person does not require nursing facility services, meaning that another discharge location would have to be sought out. A case closure, you may not see too many of these, but in effect, they are an option. What they mean is that the individual who submitted, or there's some other circumstance that we have reached the conclusion that you failed to comply with the PASRR requirements. Perhaps we can issue a determination. Inability to locate an individual is another good example. But a case closure does exist. The specified period approvals, you may see these, they may be something to keep in the back of your mind when we talk about who is and who isn't a resident and what's that status actually mean when we move forward with the training. Traditionally, you'll see the specified approvals that may be existing, and these would be perhaps for a nursing facility transfer. If an individual were to transfer from a nursing facility through the hospital to another nursing facility, this is something that you might see. This is that existing nursing facility resident, and the reason initially that this would be issued is because they require time to complete skilled therapy or transition. So the original idea for this individual to receive this type of determination is because we know that they've got something else that's existing, like that skilled nursing facility service that they just need to finish up. If we really think about the origins of PASRR, and it's important to think about the origins because we're going to talk about what PASRR looks like today. And when PASRR was created in 1987, and as it's evolved through these different rule changes, it's important to kind of focus on where we came from and where we're headed, because there are, in fact, quite a few changes that are imminent here that we'll be facing. And these aren't bad changes. These are positive changes. We're really on track to do some pretty good things here. So the origins of PASRR, this is the federal government's response to nursing facility or the nursing home industry for billing the Medicaid system for individuals whose primary focus of treatment was mental illness and intellectual disability. And this was following the closure of the traditional state-operated psych hospital system. This is really fascinating research if you guys care to look at deinstitutionalization and see just what happened and when this really began, and to think about it from a factual perspective. Boring, but nonetheless it is exciting. So look at today, and this is some of the things that you'll see in some of the language and items that you'll see that are associated with PASRR today. And this is a program that really seeks to rebalance long-term care. They perform these person-centered assessments. This might be the only comprehensive mental health assessment that an individual of this target population may receive. That's very important. And we make person-centered recommendations. These are recommendations that originate from a licensed mental health clinician or a qualified individual on the DD side that are specific to the individual. These are really person-specific and person-centered recommendations, and they're targeted to making sure that this individual functions at the highest level practicable in the setting appropriate for their needs. And we can also talk about the assurance that the needs are met in the most integrated setting. So we don't want to make people receive services and supports in a restrictive environment. If they can be in a less restrictive setting and they can get service and supports to meet their needs, that's really what we're geared toward making happen. And you'll see that it acts as a resource for existing programs to transition individuals back to the community. You've probably all heard the term money follows the person. In Ohio, it's called the Home Choice Program. But PASRR is really a great resource for these other existing programs to interact with and to achieve that goal of rebalancing long-term care, serving these folks in the most integrated setting, and getting them to transition to community. Another item that you may be familiar with, you've probably heard some rumblings, or you've probably heard some sort of a rumor about the Supreme Court Olmstead decision. The Americans with Disabilities Act is the origin of that decision. And in a nutshell, when we talk about the Olmstead decision, what it found was that it is a direct violation of Americans with Disabilities Act that was established in 1990 to retain an individual diagnosed with a mental illness, intellectual disability, or related condition in an institution when their treatment needs can be met in a more integrated setting. And that's really the impetus of what we do in PASRR. That's a large portion of this program. We certainly don't want to serve individuals in restrictive environments if we don't need to. There's a flip side to the coin, and there's a couple of different arguments, and we've got actualities. And some of the actuality to this whole thing is that some individuals with a mental illness or intellectual disability or related condition legitimately do require nursing facility services. There's nothing that says an individual cannot apply to a nursing facility or seek nursing facility services simply because they have one of these conditions or diagnoses. Hospital beds are scarce. We know that. You guys really perform a unique service in the state. You're a much-needed service. You do tremendous work for the individuals that you serve, and the work that you do, the resources that you have, is limited. So we certainly do recognize that. And the other argument that's prevalent is that community resources might be inadequate in some regions. Some of this may be unfounded, but nonetheless, it's an actuality, and maybe in some places there are resources in the community that can't meet these individuals' needs. The truth of the matter, and this is something that I think that a lot of people don't recognize, and that perhaps the perspective is a little bit blurry, but we do have almost, and at this point, this is an estimate, about 970 Medicaid nursing facilities in the state. If we think about the average nursing facility size in Ohio is 90 beds, we can do the math and think about how many individuals on any given day are in nursing facilities. It's a pretty ominous number. If we compound this with the fact that nursing facilities are not licensed or certified to provide behavioral health services, you can kind of start to see where we're headed here. And it begs the question, are the individuals that enter these nursing facilities with these conditions, these diagnoses, actually having their needs adequately met in the setting? We also have to consider integration mandates. These are rapidly gaining momentum when we think about integration mandates. We also have to consider that compounded with the federal oversight of PASRR, and we have a drastic increase in federal involvement in this program in the recent years and the recent months especially. Now, the noteworthy changes that did take place in House Bill 59, which was the last biannual budget, did disallow the use of the hospital exemption from psychiatric units, and I use that term interchangeably, psychiatric hospitals or psychiatric units within a general or a med-surg hospital. This was effective on the 29th September 2013, so we are at this point roughly a year down the road after the change took place, and we've had time to see the impact, and that's a lot of the rationale for our presentation today. Don't be confused by the fact that that this is a really targeted disallowance. The hospital exemption can still be used for the conditions that these folks may be treated for in a medical surgical unit, but the focus here is saying that no longer will we permit the use of the hospital exemption from that psychiatric unit within that general hospital or from the freestanding psychiatric hospital. All right, so what does this mean for psychiatric units and hospitals? And this is the core of what this presentation is about today, the expedited PASRR process. It goes without saying that there's a lot of people here that have really considered how you may be and how you have been impacted by the process. We have come to the realization that the work that you do is spectacular, that the resources that you have are limited, that you need to get folks out of beds in a timely fashion. So what we've done is, in effect, taken all the feedback. We're a year down the road, and the state has used all the resources that it has available, and we've implemented a process, an expedited process. This is for this targeted population. This is for the pre-admission screen applications that originate from a psychiatric unit or psychiatric hospital. These have become the focus of what we are currently doing here in PASRR. The expedited process is that the PAS-Psych cases are given priority review. It's important to understand that the PASRR bureaus, the PASRR Bureau here at Mental Health and Addiction Services, as well as Department of Developmental Disabilities, process quite a few cases, thousands of cases. So this subset is definitely a priority of the cases that we see. The annualized average turnaround times have been substantially reduced, and by this I mean that we have a 48-hour turnaround time from the time of application for this target population. We also have determinations issued during business hours 7 days a week. These are some pretty substantial concessions that have been offered to accommodate And to put this in perspective, we're implementing a 48-hour turnaround at the time of from the time of application of these cases. Now, the federal requirement for us in PASRR to determine pre-admission screens is roughly 2 weeks. The Code of Federal Regulations assigns a time of 7 to 9 business days. And to extend that a little bit further, just think about it, that the requirement is annualized, an average of an annualized average. So 48-hour turnaround time from application, and this will be our attempt here on the annualized turnaround times. We've made some pretty drastic changes to operations. So we will be issuing determinations during business hours 7 days a week, and that will eliminate any of the concerns that you might have had regarding the non-business hour or the non-business day determinations when you need to have an individual discharged into a nursing facility on an off day. There's a couple of quick response tips just to keep in mind, and from your perspective in the hospitals, especially for the discharge planners or the individuals that are responsible for completing the 3622, when we're talking about this subset, this special population, there's some things that you can do that will really assist in this process. And as a matter of fact, we really depend on you to do these things to make sure that this process does work in an expedited fashion, that it runs smoothly, and that the individuals that we're attempting to process here, your patients, the individuals that we serve, receive the highest benefit from our process. So submit the 3622 at the time you discover the nursing facility's a discharge location. If you have a conversation with your patient and you learn that they want to access nursing facility services, start the 3622. You really have to start the process early, and what that will do is it'll allow you to submit early and get the earliest possible indication to the appropriate individuals that this discharge location is in fact a nursing facility. Clearly indicate that that 3622 is originating from a psychiatric unit or a psychiatric hospital. For those of you that are familiar with the 3622, the form is a bit constrictive when we talk about how the thing flows. And there are a couple of lines. If you work through the 3622 and you can't indicate clearly through some checkbox or other mean that you are in fact a psychiatric unit or hospital, please write to the side. That's always a decent tip. There's room to write. There's different lines you can indicate. We'll see that the submitter location, in fact, is from a psychiatric unit or a psychiatric hospital, but some other indicating information, a cover sheet is a good example. But just so we're clear that the originating location is in fact a psych unit. Include all the documentation to support the need for nursing facility services. We'll talk about this a little bit more as we go forward. But documentation to substantiate the need for nursing facility services is really critical. 3622 in itself is a lot of good information. It's enough for the folks that are qualified to look at these to get a good idea of what the situation might be, but that additional supporting documentation is really relevant and really important to have when we want to look at the whole picture and try and reach a conclusion. Confirm the 3622 was received, and we'll go ahead and move to some other quick tips, and I think we'll expand on these just a little bit. When you complete the 3622 and you submit, it's important, and if it's an option for you and if it's relevant to you, to indicate that nursing station that's responsible for the patient. If you're in a large hospital, if you have multiple nursing stations, then indicate exactly where you can be reached at, the contact number or the some other identifying information for the actual nursing station that's responsible for that patient. Supporting documentation should be attached at the time you submit the 3622, and I tried to clarify the importance of having the additional documentation, but the timing. I know there may be constraints with the new movement toward the electronic medical records, but please do the best you can. If you can print these ahead of time, if you know that the discharge location is a nursing facility, if you know the assessment is scheduled and you have a moment, print them ahead of time. So these are documents that you could perhaps actually give to the assessor that appears to do that assessment at the hospital. And another tip is to keep a record of your fax submission confirmation. What this does is it shows that, in fact, your fax did go through, that it went across, that it was received. And if you have any type of an issue where there's a delay or the claim of perhaps a fax that was not responded to, the fax submission confirmation, that cover sheet, will help us when we look to quality assurance if we need to do some sort of a research and find out if there was, in fact, a hiccup in the system. So another tip is to keep that confirmation. And if you keep staff informed, that's very important, and be prepared for assessments that occur during non-routine business hours. And traditionally, I guess if we think of normal business, 9 to 5, I know hospitals really don't have any traditional hours. I think that you guys stay busy pretty much all the time. So I guess what this means is that in an effort to expedite the assessments, there might be times where the assessment has to occur outside of what somebody would perceive as a normal hour. Perhaps they have to occur in the evening, perhaps early in the morning, perhaps on a weekend. So this is all part of the equation on how we can expedite the pre-admission screen application process and get these quick turnarounds. Technical assistance is important. It is available. Status checks, these are the telephone calls that you can make to see where your application is, to find out what the status is. During the weekdays, Ascend Management's available. They always have been. Their number to contact is here. They've got a specific extension, 3402, for these types of cases. So during the weekdays, Ascend Management definitely available for technical assistance. Their fax number, this is a standard fax number that they receive and that they route accordingly. The PASRR Bureau is also available. Our phone number, our main line is here, the 466-1063 number. If you have questions, we have great support staff that are willing to help, and we can get you the answers that you need on your status checks or other technical assistance. We also have a standard fax number that this is monitored routinely, so just keep in mind that if you submit a fax, we've got multiple eyes looking at the fax, and we can definitely respond. We'll talk about routing of the 3622 in response to these, but perhaps the PASRR Bureau, that fax number might be for supporting documentation, Ascend as well for supporting documentation. If it's not available at the time the assessment actually takes place. On the weekends and public holidays, here's what I can provide now. It is that we will be monitoring calls. So if you call the PASRR Bureau at the main line, it does have a voicemail, and there will be somebody that checks these voicemails. I can't tell you exactly the details of how this will work right now, but I can say that the voicemail is monitored. Leave a message with details. We will return a call to you as soon as humanly possible. There may be an extension or expansion of this for the weekend and public holiday, technical assistance and status checks. If there is, in fact, we'll certainly communicate that with you. If there's a different number or if there's an alternative, if perhaps in the future there's an actual live person. So we'll stay in communication and let you know certainly if there's another resource for you on the weekends or public holidays. There's a preference right now for an automated 3622 submission. For those of you in the hospitals that are familiar with the electronic hospital exemption notification or HINS system, that is the same system that will house the PASRR application. So the HINS PASRR system will definitely assist in expediting priority cases in the very near future. There will be a release, I'm sure, at some point here from Department of Medicaid in conjunction with the Department of Aging about some go-live dates, but just keep in the back of your mind that the preference is certainly to use the web-based, the internet-based automated electronic 3622 submissions that will really help us streamline the process and get information exactly in real time. One of the points that I'd like to spend a little bit of time on that's relevant to you guys in the hospitals especially is an important question. And it's a simple question, but nonetheless, it's very important. So if you have an individual that is a patient in your hospital and you ask the question, where did the individual come from? Where is this individual from? If they are from somewhere other than a nursing facility, this is in fact a pre-admission screen. They could be in a group home setting, they could be in an assisted living setting, they could be in some other setting that is community-based. They are not in a nursing facility, not categorized as a nursing facility, group home, or what have you. The psych unit or the psych hospital is responsible for completion of the 3622, and they do submit this to Ascend Management. That's the fax number that I just provided, the 866-299-0029 number. Ascend will route these accordingly, and if there are indications of a dual diagnosis, meaning that they have indications of mental illness as well as developmental disabilities, Ascend Management certainly monitors these cases and will assure that they're routed appropriately. PASRR determination on this type of an application must be issued prior to nursing facility admission. So you've got to have the PASRR outcome before you can discharge your patient to the nursing facility to be in compliance with these programs. Now, on the other side, we talk about a resident review, and I mentioned earlier, what does a resident look like? What's resident status? What's really the distinction between the pre-admission screen and the resident review? There's quite a difference. So if we're talking about resident reviews, and you say, where did the individual come from? If they came from a nursing facility, this is likely a discharge for some acute treatment, and the individual perhaps wishes to return to the same nursing facility or maybe transfer to another nursing facility closer to friends and family or what have you. The responsibility to complete the 3622 rests with the nursing facility in this situation. It's called a significant change in condition. The nursing facility is familiar with this. They're the ones that complete the form upon the time they discharge their resident to your hospital, and they're familiar with the process for submitting these applications. The next point to clarify is that the nursing facility resident may return to the same or different nursing facility, as I just stated, as soon as the hospital treatment concludes. We'll expand on this a little bit here in the next slide or two. This is sometimes a concept that's a little bit tough to wrap your head around. I think there's some misunderstanding perhaps of this specific point. There's maybe some contention, but we'll certainly try and dispel that today and kind of clarify how this process actually works. So the PASRR determination will be issued to the resident at the nursing facility. We've got systems in place. We're familiar with the submission of the 3622. We know where it came from. We've got quite a bit of data entry. We'll take care of routing the determination to the right place, to the right individual. To expand on this subject a little bit further, we talk about resident choice. We talk about nursing facility returns, nursing facility transfers, and this is the concept of the resident. What does resident mean if this is a nursing facility resident? So to walk you through some of the details, and then we'll try and flesh out a little bit here. So if an individual is an existing nursing facility resident and they have PASRR approval and they have a level of care, if I'm an individual that met the minimum federal requirements to be in a nursing facility through PASRR and was found to be the appropriate level of care, and I have Medicaid reimbursement for nursing facility services authorized, and I am sent to one of your psychiatric units or a psych hospital for treatment, and I wish to return to the same nursing facility or transfer to another nursing facility, there is in fact no need to complete a new level of care or await PASRR results prior to discharging your patient. So let's talk about that just a little bit, because I think that there's probably enough confusion around this one point to spend a little bit more time on it. Now, there are some processes that are embedded in the rules that allow some autonomy on the Department of Aging's part. They're the ones responsible for the level of care. There's something called a desk review. I don't think that we really need to jump into that right now. But think about this as perhaps a barrier, and maybe a superficial barrier. And it all is contingent upon the fact that these results are portable. So PASRR approval, as long as you're in the nursing facility, level of care is portable. As long as you meet that status, and that status may change in the future, but as long as you have met that requirement, those results are portable. barring a return to the community. If I return to the community, the unfortunate truth is that I've got to start the process over again, and that's why it's so important to ask, where did this individual come from? So the planned go live for the expedited process that we've been talking about is November 16, 2014. Pencil that on your calendars. I can't foresee any changes in the near future, but this is the tentative go live date. If the stars align here, we'll make it by November 16th, but that's where we're headed right now. All right, so let's recap a little bit about some of these major concepts that we talked about when we're dealing with the expedited pre-admission screen process from the psychiatric units or psych hospitals. So the PAS application from a psych hospital unit is a priority at this juncture. Please assist in the PASRR process by being clear and thorough, and a lot of that relates to you as the responsible person in the psychiatric unit or hospital, completing the 3622, providing supporting documentation, and doing all those things that we talked about to make sure that we're able to implement this process here as efficiently as possible. Take ownership of the process. You know, I don't know if it's something that everybody does right now, to make a telephone call, to keep that fax confirmation page, but these things are very important when we're talking about these cases, and it will certainly assist us in expediting this process as well. And ask the question about PASRR history and nursing facility residency. This could be really a great discovery. If you know that the individual came from a nursing facility and they're returning to the nursing facility, we don't want to hold up any cases that don't need to be held up. So you might have a superficial barrier on your hands when in fact you're perceiving it to be something that's much more complicated, so keep that in mind. And always, always provide detailed feedback for quality assurance. If you have any issues, if you're in a position where you think your fax isn't going through or you're not getting timely responses, we need to stay informed of this information. It'll certainly be recorded. We'll do a quality check, and we'll utilize that to improve processes as we go forward. All right, so in closing, there's a dedicated email address. If you do have any questions, concerns, comments, or otherwise about this expedited process, send me a question. We'll get it answered. The link should be live there, but it's expedited process at mha.ohio.gov. There'll also be some training materials. What I'll try and do is assemble maybe that quick tip sheet for you guys so you can see kind of the things that you need to do to really assist with the process and maybe use that as a job aid. The actual webinar will be available. I can make the slides available. We'll also do a frequently asked questions that originate or that end up in this email inbox, and we'll put that out there too. And all that stuff should be available at this link. And if it's not, email me. I'll update the link and get it to you, but I think it's up and running at this point, and I'll have the information posted here in the next day or two. All right, so with that being said, definitely thanks for the attendance and the patience. I know there's a lot of complicated information here, but do rest assured, we've got you guys in mind. We've really made all the accommodations that we can possibly make at this juncture, and the focus is on the patients. We want to make sure that there aren't barriers to getting these folks to the right places, and that your processes are recognized, and that we're working collaboratively as we implement this expedited process. So we've got a couple of questions, or a couple of minutes here. If there's any burning questions, you know, I'd be glad to entertain. If you bear with me just a moment here, I'll see if there's something relevant here that you know, perhaps we can. Okay, so let me just run through a couple of questions, and I'll see if there's something that's pretty superficial here that we can address today. Yeah, copies of the slides, those will definitely be available here on the website that I mentioned. Yeah, and the slides will be available. There's a question about the nursing facility not completing a 3622 or delaying that process upon discharge to the hospital. What we can probably do is think on that a little bit and come up with a response. What I'd ask is if you send that directly to that email address, and then I can think on that a little bit and get you an appropriate response. But we'll think of something on that one. Okay, so if we say that PASRR results are portable, is it correct that the hospital exemption notification approval is not portable since it's only good for 30 days or less? It's a bit of a technical question. What I'm going to do is I'm going to include that in the frequently asked questions document. I think the answer may get a little bit dry because it's deeply rooted in Ohio Administrative Code. So thanks for asking the question. I'll put that in the FAQ, and then I'll put the appropriate sites for the administrative code. I think that's probably going to be the best answer for that. Okay, do you have to wait to do the PAS-Psych hospital to NIF till you find a nursing facility that will accept the patient, or can you submit it prior? You know, it's never a bad idea to complete the 3622. I know sometimes you guys run into the obstacle of where you might not be able to find an admitting nursing facility. Unfortunately, that's something that you're probably better versed in than I am. If you can, you know, make some best efforts and find that admitting nursing facility, ultimately you have to have a discharge location. So you can submit the 3622. Remember that if this is a pre-admission screen and they're a patient in your hospital, you will be the submitter. So the hospital's address will be on the document. Any correspondence for the outcome will rest between Mental Health and Addiction Services or Department of Development and Disabilities and the hospital. So for example, if we can complete our processes and give you the results, then you can still work toward the discharge location. And I'll clarify that further with some other detailed information in the FAQs as well. One more question here. Should we be submitting the 3622 to the Area Agency on Aging or Ascend directly? That's a good question. I'll include that in the FAQs as well. But for purpose of submission, now this is a subset of the population. This is the pre-admission screens only that originate only from psychiatric units or hospitals. These will go directly to Ascend Management, 866-299-0029. They'll take care of the routing. This is the only application that will be sent directly to Ascend Management. Anything else aside from this type of application will still be routed appropriately through the area agencies on aging. A question on how do we handle the dump to a psych unit and the nursing facility does not want to take the patient back. This is a real question. It's a good question. I can't give a firm response now, but I'm going to think on that. I'll put that in the FAQs and probably give you some better indication once I touch base with some other resources. Now, what I can say is that there is a designated advocacy group available in the state long-term care ombudsman. These folks are great. They work with people across different settings, hospitals, nursing facilities, and they really advocate for these. So maybe if you have this information at hand and you know the nursing facility simply won't accept them back and you can't find another new admitting nursing facility, the long-term care ombudsman can intervene and we can at least start a dialogue and really advocate for the individual. But I'll expand out on that too. I'll definitely include that. Thanks for the question. On the point of the nursing facility not being timely when they send a psych hospital patient, are they required to file and update PASRR for a change of status? And let me just read this one again so I'm clear. The nursing facility not being timely when they send a psych hospital patient, are they required to file an updated PASRR for change of status? And I think what you're referring to is the significant change in condition. So currently the Ohio Administrative Code does require the hospital, or excuse me, the nursing facility to complete the 3622 if there is a change in condition. The time frame for doing that is currently specified at 72 hours. So we want a quick submission if the nursing facility does in fact recognize a significant change in condition. The obligation is to complete that form within 72 hours and submit it appropriately. And that's a resident review event. That's what we talked about a little bit earlier, but they do have the responsibility to complete the 3622 and submit it in a timely fashion, and that is governed by the Ohio Administrative Codes. Faxing directly to Ascend, I think that we may have covered that. So remember that this is just a subset of that population, and the specific applications are, in fact, going directly to Ascend. Is there a way to expedite the resident review for patients going to a new skilled nursing facility, waiting for patients ready to leave our hospital but needing the determination to transfer or to start a new level of care? And that's the issue that we talked about, and the thing to keep in mind is that barring a return to the community and considering that an individual has prior PASRR approval and that they have prior level of care approval, the admitting nursing facility doesn't need to wait for a new level of care. There's not a strict obligation that says the nursing facility can accept this individual. I think that this is a lot of misconception, and this is really a self-imposed barrier. So I'll address that further in the FAQs, and if you have any further questions or concerns about this, send it to the email address. But what we're really saying is that barring that return to the community, we're looking at transfers. I think that this is just a self-imposed or superficial barrier where the nursing facilities believe that perhaps they can accept a patient from a hospital that never left this institutional setting without PASRR approval, when in fact that's incorrect. So let's run through a couple of other quick questions here, and then we'll probably wrap up. So what if a patient comes to us from a facility on an exemption form, and I don't know that I'm clear on the question, does RES, REV, maybe you can clarify that, from facility count as the 3622, and do we need to wait for a determination prior to return to move to a new place? I think what a resident review does, a resident review from the facility count as a 3622. So this is what we just talked about. If an individual discharges from a nursing facility, and in fact they're a nursing facility resident, they've met these requirements, this is a resident review situation. So the obligation to complete the 3622 rests solely with the nursing facility, and there's nothing that says that the individual can't return to that nursing facility or transfer to another nursing facility while this process is taking place. Barring a return to the community, that's the only thing that would be considered an interruption in that care. Is the same procedure followed for out-of-state PAS-Psych NIF applicants? The out-of-states is a question that we'll address in the FAQs. That's going to be more of a formal response. So thanks for the question. I'll put that in the FAQs, and I'll also notify you guys. I've got a list of attendees, so what I'll do is I'll email everybody when the slides are posted and as we progress and get these other documents up, so you'll have formal notification. So keep in mind, I'll definitely place that question on the FAQs with a well-thought-out response. So how can a hospital justify holding a patient solely for the PASRR determination? I may not be clear on the question. Maybe if you could clarify, maybe that's awaiting the PASRR outcome. I don't know, but if maybe you could clarify that question a little bit. Maybe I'm just a little bit confused. Or send that to the questions, the email questions, and give me some more details, and I'll certainly flesh that answer out for you. So the issue with nursing facilities accepting registered sexual offenders from psych unit as PASRR approved, this is an important question. It's a good question. I'll put that in the FAQs as well. There's some recent developments around sex offenders that came from our legislature, so I'll reference that. So you guys will have some formal information about some recent and current developments about this group. Do you still need to do the 3622 if they go from a nursing facility to a hospital back to the nursing facility? Again, this is the significant change in condition. So as the question asks, the 3622 from a nursing facility to the psych hospital to you guys and then back to the nursing facility, that's a significant change. 3622 originates from the nursing facility. The patient transfers as they choose or as your hospital treatment concludes. Can you clarify what is faxed to Ascend directly rather than directly to the area agency? And I think we've touched on that. This is a question regarding treatment, and what I may do is just hold off on that. That might be a bit outside of what I'm capable of answering, but I will, in fact, get a response. So if you were the one that answered that question, please rest assured that we'll certainly get a response to your question here as quickly as possible. What I'm looking at is a question regarding insurance companies. Again, this may be a question outside my scope, and it's related to PASRR, so we'll look at it if that is your question. In fact, we'll take a look and get a response to you here as quickly as possible. Will the frequently asked questions be in the training materials, and then where can we access those FAQs? We covered that earlier. They'll be available on a dedicated page through the external website of the Ohio Department of Mental Health and Addiction Services. Documentations to include with the submission of the PASRR, that's a really good question. What I'm going to do is circle back with some of the folks that actually are viewing this information and ask them what might be most beneficial. We'll include this for sure in the FAQs, and that'll help everybody, I think. So let me circle back and get the right response there, and then we'll get something out in the FAQs for you. All right, so I think that's about all the questions that I can see right now. What I'm going to do is just refer to what we've got here, the expedited process, to the email inbox. Please don't hesitate to ask questions, and also to access those training materials. So we'll have an open dialogue, I think, going forward. I know there's still questions and concerns out there, but we'll do the best we can to certainly to address all of your concerns in a